Okay, so this will be the last imaging modality we'll talk about, okay? Is magnetic resonance imaging. Now, if you recall, the type of energy that's used determines the modality, right? So if you're using sound waves, that's ultrasound imaging, okay? If you're using X-rays, that's X-ray imaging, okay? In MRI, the type of energy that's used is a combination of radio waves and strong magnetic fields, okay? That's why they call this magnetic resonance imaging, okay? So let me just give you a little introduction to magnetic resonance imaging. So first, uh, anytime you have a current, okay, a charge flowing in a closed loop, that will develop a magnetic moment, okay? And that magnetic moment is equal to the current times the cross-sectional area, okay? And as it turns out, this is what happens essentially in our body with a hydrogen atom. So a hydrogen atom has a charge on it and it's spinning, okay? And because it's filling a closed loop, it also has a magnetic moment. It produces its own little magnetic moment, okay? And the body has a lot of hydrogen in it, okay? Here's just an example of a long chain of uh, uh, carbon with hydrogen, okay? Fatty acids and different type of molecules have a lot of uh, hydrogen in them. And it's important to note that they all have a charge, they're all spinning, and they're all producing a small magnetic moment, okay? Now, if you put these small little hydrogen atoms that are spinning and having their own little magnetic moment, they're typically randomly oriented in the body, okay? If they weren't randomly oriented in the body, we would be more magnetic, right? We would be able to attract things. But essentially, because they're randomly ordered in the body, they kind of all cancel each other out, and we are not magnetic, okay? But if you put these in the presence of an external magnetic field, okay, this we call that a B field, okay. If you put all of these small hydrogen magnetic moments in the presence of an external B field, a strong one, guess what happens? The magnetic moment of all the hydrogen atoms will align with the field, the magnetic moment of the external B field, okay? And they typically will align in two different ways. They'll either align parallel like this, okay, or anti-parallel like this, okay? Whichever state is stable, it'll align to. Most of them are going to align in this parallel state. Okay, so an important concept to understand when it comes to magnetic resonance imaging is something called precession. Okay, so precession is what happens when a force is applied to a spinning object. Okay, with angular momentum, what will happen is it'll have a directed force at right angles to the force. Okay, so because you have hydrogen spinning, okay, because you have a hydrogen atom spinning, it's a charge that's going in a closed loop that produces a magnetic moment, okay? And that magnetic moment is spinning, okay? And you put it in the presence of an external force, which is the external B field, okay? You'll get precession, okay? Which means this magnetic moment will start to spin about the external B field, okay? So it'll kind of cause it to wobble about the external B field. Okay, so they don't just line up perfectly here. They don't just line up perfectly, but instead they all kind of wobble. It's called precession. Okay, precession is also something that they have to watch for when launching a rocket into space. Uh, uh, it can't precess too much or it'll fly apart, okay? But again, you're going to have precession anytime you have a force that's applied to a spinning object that has angular momentum, okay? And that will produce a directed force at right angles to the force, okay? And that makes it wobble about the external force. And so this is called precession. And the frequency of precession can be calculated as the gyromagnetic ratio times the external magnetic field, the strength of the external magnetic field. Okay. So if we take a look at a scenario where we have a hydrogen atom that is spinning, producing a small magnetic moment, and we put it in the presence of an external B field, it'll align to the magnetic moment of this hydrogen atom will align with the external B field, but it won't align perfectly. Instead, it'll precess about the external B field. So it'll kind of wobble around it, okay? And the frequency at which it wobbles around it is called the frequency of precession, okay? Now, so what happens if you inject into this system a small pulse of radio waves, an RF radio frequency pulse at the same frequency of precession? Okay, now remember, an RF wave, it's electromagnetic energy, right? Has a electric field and it has a magnetic field, right? And RF waves kind of propagate through space like this, okay? And the magnetic field switches to electric field and it switches back to magnetic field. And so the magnetic field goes kind of like this. I guess I didn't draw it here. But if the frequency of this RF pulse matches the frequency of this precession, what will happen is it'll tip it that magnetic moment of the hydrogen atom on its side, and so the magnetic moment will spin around kind of on its side, okay? Because it's because it absorbs that energy, because the frequency is the same. The frequency of this RF pulse matches the frequency of precession, okay? It absorbs that energy from the RF wave, and because it absorbs the energy on the RF wave, it tips it on its axis. It starts to resonate and it tips it on its axis, and it'll spin around like this. And then we turn off the pulse, the RF pulse, and the material will release some of that RF energy. And the time that it takes for the different materials to, or different tissues to release that RF energy uh, uh, is what we can use to measure contrast in different tissues. So different tissues have different relaxation times. Okay, so here the magnetic moment is on its side because it's resonated and it with the RF pulse, and it absorbed the RF energy and is spinning around. We turn off the RF pulse. Everything wants to, all these magnetic moments want to snap back and realign with the external B field where they were. Okay. But the way they're bound together with different tissue will have different relaxation times. And this gives rise to contrast. Okay. So as it snaps back and realigns to the external B field, it releases that RF energy, and we can detect it. And this is how we can measure different things in MRI. Okay. So this is also how slice selection is determined. Okay. So if you have a MRI imaging system, which has a tube that you can put a patient inside, okay? And remember, the patient the patient's hydrogen atoms have a whole bunch of little magnetic moments, are going to align themselves with the strength of the external B field, okay? And if we inject an RF pulse, and we inject the RF pulse at a specific frequency, okay, it'll cause it to resonate. If that frequency matches the frequency of precession, it'll resonate and cause these magnetic moments to tip on their side, okay, and absorb that energy. And if we let it go and turn off the pulse, they'll snap back and try to realign with the external B field and release some of that RF energy, okay? And so this frequency, okay, we call that the Lamar frequency, okay? The frequency at which the RF pulse matches the frequency of precession is the Lamar frequency, okay? And so what we do in the tube is we put a strong external magnetic field, a B field, but it's not a constant B field. Instead, the intensity of the B field has a gradient. It's a gradient B field, okay? Meaning it's stronger over here and weaker over here, okay? And so what does that do? Because the frequency of precession is equal to the gyromagnetic ratio times the strength of the B field, that gives a different frequency of precession along multiple slices of the body, okay? So along this slice, closer to the feet, the frequency of precession would be higher, and then in the head, where there's a lower B field, the frequency of precession would be lower, okay? And you can use this for slice selection, okay? So again, depending on how this gradient B field is set up along the patient, you can create different slices, okay? And that's because you'll create different frequencies of precession throughout the body, okay? And when you inject an RF pulse, it'll only resonate with the protons, the hydrogen atoms that are rotating at that frequency. And so only the proton hydrogen atoms that are rotating at that frequency will absorb or resonate with that external RF pulse and absorb that RF pulse, okay? Then you turn off the RF pulse and they try to snap back and realign with the external B field, and different tissue take different times to do that. Time for relaxation, okay? And so this is how slice detect is determined in MRI imaging. Okay. All right. So that's just a quick introduction to MRI imaging. Again, we will go deeper into it on next Tuesday. We'll go ahead and end here for today. Reminder, Thursday is going to be for mimics. Please work on the mimics, and we'll end right here, and we'll see you next Tuesday. Okay.